Time for me to share another fun case walkthrough. This is another patient that I saw, knee patient. We got better. So this is a patient that came in. She had both knees hurting her, but her left one was worse. She said she first started feeling problems 8 years ago, and at the time she came in, she was feeling daily pain with her knees. It was a gradual getting worse over time. This might sound familiar to some of you, but this was her case. She was told she was bone on bone. She went to the ortho, and she had already gotten a cortisone shot. So there was pain on the insides of her knees. It was bothering her sometimes at night. She couldn't bend her knee. It was sharp pain when she bent her knees. And the goals for her is she wanted to do horseback ride. She wanted to do stairs. She wants to do yoga. And she was also interested in trying to avoid a knee replacement. I don't blame her. So anyway, let's take a look at her x-rays and we'll talk about them for a minute. So she came in and these were her x-rays. So as we look at this knee, this is her left knee, the one that was hurting worse. And you can see that the entire joint is very thin, especially on the inside. It's almost touching. I can see why they might have said bone on bone, but there still is some real estate there. There's still something we can work with. So we've seen the true bone on bone ones where their bones are actually touching. This one, we actually still have some real estate this side. Here's her other knee. Now this side, you can see again, the inside of the joint is collapsed. The outside looking wider. It's not hurting her quite as bad, but both knees were hurting her. So she decided to move forward and get the regenerative medicine, the Wharton's jelly stem cells into her knees. And she is already doing great. I mean, it's been only a few weeks now, and she says she has no pain. So we do see that sometimes because we combine our Wharton's jelly stem cell product along with exosomes, and those exosomes have an anti-inflammatory effect. They're also cold when we put them in because we have them frozen and we thaw them out. They're still a little chilly when they go in, and there's an anti-inflammatory effect from that. Combining that with the exosomes that are also anti-inflammatory, you can, many times we're noting that there's a fairly quick and fairly immediate response within even the first few weeks. Now, ultimately, we want to get a long-term change. When we get results with these cases, we're seeing results that last years, not just months. But ultimately, we have to get those tissues to grow and regenerate tissue. And that takes time. So if you think about how long it takes for a broken bone to heal, for example, in your body, if you have a really bad break, it's going to be 8 to 12 weeks for a broken bone to heal really good, because that's how long it takes for tissues to grow in your body. That's just how long it takes. So when we're dealing with something like trying to regenerate new tissue in knees, it's going to take time, months sometimes. 3 months is very common. Usually the cells will stay in there for 12 to 18 months. But we're usually seeing the best outcomes in the first 5 to 6 months. And it's funny, everybody's different. Some people, we have these fast results. Other people, they initially are discouraged. They're like, oh, I don't feel it, it's not working yet for me. But then it's about month 4 where they start going, you know what, I've noticed it's been a couple weeks and I just haven't had any knee pain. Those are also fun cases. But anyway, I love sharing these cases. I hope you like hearing about them. I know I have a bunch of testimonials where you get to hear the people actually talking about their stories and how it impacted their lives. But sometimes people like to look at the x-rays and see how bad people's knees were when we see them in the first place, and to see that it actually worked for them. And even in cases where they're told that they're bone on bone, we're actually getting some good outcomes. So I hope you enjoyed another case. Take care.